Good evening, Dr. Jenkins, and to my colleagues. Today, my presentation is on the substance use of fentanyl. My name is Toya Smith. Fentanyl is a potent synthetic opioid approved by the Federal Drug Agency that is used for sedation, relaxation, pain relief, euphoria, and anesthetic. It was originally developed in 1959 by Paul Janssen and introduced in the 1960s for pain management in cancer patients. It is 50 to 100 times more potent than morphine and is used in the medical setting with very strict supervision. It is legally manufactured and distributed in the United States. It is considered a Schedule II narcotic under the United States Controlled Substance Act of 1970. Due to its rapid onset and high potency, it has become a very popular and dangerous drug of abuse. Fentanyl abuse began to rise in the early 2000s. From 2005 to 2007, fatal overdoses were associated with the abuse and misuse of clandestine, which is illicit produced fentanyl. This coincided with the broader opioid epidemic in the United States. Illicitly manufactured fentanyl started appearing in the drug market mixed with heroin, cocaine, methamphetamine, and other substances, leading to death by overdose. Fentanyl overdose has become a major health crisis. Its misuse has been diverted via theft, fraudulent prescriptions, and it can also be distributed by patients, physicians, nurses, physician assistants, and nurse practitioners and pharmacists. It can be consumed by being snorted, smoked, ingested orally by either a pill or a tablet. It can be spiked onto blotted paper and used. It can be given intravenously and by transdermal patches. Fentanyl-related overdose deaths have surged in recent years. The first death was reported in the early 1980s. Deaths have continued to rise with 73,838 overdoses in deaths in 2022. In 2021, synthetic opioids like fentanyl were involved in over 70% of opioid overdose deaths in the United States. The prevalence is very high in places like West Virginia, California, Ohio, New Hampshire, and many other places for sure. Fentanyl's presence in the drug supply has complicated efforts to change the opioid epidemic. It's made it very, very hard. Common street names for fentanyl are Apache, China Girl, Chinatown, Dance Fever, Goodfellas, Great Bear, He-Man, Jackpot, Murder 8. Synthetic fentanyl is almost twice as commonly overdosed in deaths as the prescription drug. People who survive fentanyl overdose have been unaware that they have taken or how much of the drug they have taken. There are early warning systems now in place, pill testing technology, rapid test strips, trainings, and overdose trainings to help reduce the crisis of overdose. Some of the risk factors in the vulnerable populations are history of substance abuse, mental health disorders, patients with chronic pain, people with access to prescription drugs, socioeconomic factors such as poverty and unemployment. The vulnerable populations are adolescents, young adults, individuals in rural areas, and individuals in economically disadvantaged areas. Some of the short-term effects of fentanyl are euphoria, dizziness, drowsiness, nausea and vomiting, respiratory depression, urinary retention, confusion, and constipation. Some of the long-term effects are dependence and addiction, severe respiratory depression, increased risk for infectious disease such as HIV and hepatitis C, cognitive impairment, and organ damage. Some of the signs and symptoms of abuse on assessment that you'll find are constricted pupils, respiratory depression or failure, cyanosis of the skin, needle marks when the individuals inject, unconsciousness or lethargy, frequent flu-like symptoms, social withdrawal, unexplained financial problems. The potential for overdose are used as suicide weapons of choice for fentanyl, or basically a small of the amount of fentanyl can be very lethal and can cause an overdose. The high potency of fentanyl increases the risk for overdose and suicide. Some individuals may take an unknown amount of fentanyl that can lead to overdose. Fentanyl overdoses can lead to coma, death, and respiratory distress. So the care plans for patients. The pharmacological treatment for fentanyl overdose is naloxone, which is given for the overdose to reverse it. That is basically the standard rescue drug. Medication-assisted treatment, which is MAT, with methadone, bupropion, pronephrine, or naltrexone. Non-pharmacological treatments are cognitive behavior treatment, contingency management, support groups, including Narcotics Anonymous. And you would like to educate your patient on the risk of fentanyl use, the side effects, and the adverse effects. You also would like to train them on the use of the naloxone. Information on safe practices is also important to teach them, and also harm reduction. You should refer your patients for CBT therapy, refer to an addiction specialist, and also refer to mental health services. You can also do follow-ups with them. Initially, you would like to do follow-ups in 2 weeks to monitor their progress. Follow-up every 2 to 4 weeks after that to continue to monitor their progress and provide ongoing support and counseling. You also can alter and make adjustments when they come in to see if the treatment plan is working for them, and if it's not, then you can make adjustments as needed. In conclusion, fentanyl abuse provides a significant challenge in the United States due to its high potency and risk for overdose. It is a major threat to both people and public health. It is important to address the crisis as it is a multifaceted approach, including education, prevention, and comprehensive treatment plans. Coordinating efforts with other agencies in the community can possibly reduce the impact of fentanyl abuse on individuals and communities. These are my references.